What about redness in the winter, and the redness your face gets, and the dry, cold weather making our face more red? What can you do for it? Well, you can come see us. There's a lot we can do. I'm going to start with talking what our world's best esthetician, Chelsea, has to recommend. Things we can do in the office, things she recommends, procedures she can do to really get that redness out of your face. Chelsea, what can you do to help someone who has red facial skin and dry skin in the winter?
So I know you and I work well together. You get to work in a deeper level of the skin and I get to work more surface level. A lot of patients that have redness and irritation, it's irritable. You know, it's not only the redness, but it's painful, it's dry, it's uncomfortable. One of the best things we can do is use creams to help just create this occlusive seal, or this top barrier to really help the wind and the elements from kind of getting into the skin and losing more moisture. So appropriately moisturizing the skin using creams that are very calming and soothing is really going to help. There's always treatments that we can do to hydrate the skin. I think that when we kind of hit it from all different angles, doing a treatment in the office or doing a laser with you, or Dr. Walia, doing topical products with me that kind of treat the surface of the skin, and then working with your products and treating the skin a little bit more deeply, we're kind of creating this full circle where we're treating every level of the skin.
What can you specifically, what sort of products do you recommend, or what sort of procedures can you do to really help someone who has redness?
Yeah, so one of my favorites is Rosatrol. It's by Zeo Skin Health. It really helps strengthen the skin for patients that are just sensitive or sensitized from maybe different procedures that have broken down their skin. The elements will do that to your skin also, and it's great for patients that have rosacea. So anything that's red, Rosatrol is great for. We also have a product called Hydrating Cream. It's also by Zeo, and it has, we've talked about this before, it's one of my favorites. It has colloidal oatmeal, so it's great for patients that have eczema or psoriasis, or patients that are just kind of overall irritated. We also have really awesome masks. So some of the masks that we have are even good for post-laser. So whether you have laser treatments where your skin is hypersensitized, or even just irritated from the elements, there's a Skin Suitables biocellulose mask that we can only do in treatment. It's not available at any store. It's just professional use, and I use the red LED light to help stimulate that collagen, to help stimulate that circulation that helps your skin basically absorb all of the ingredients that are going to help to calm and soothe the skin.
So there are masks people can do. We have the LED light. Anything else you can think of that we can do to help redness? Any facials in particular, or hydrofacial would help as well?
Well, any treatment that we do is really going to help, because essentially treatments in here are going to exfoliate the skin. When we're properly exfoliating, we're able to infuse a lot of nourishment into the skin, specifically hyaluronic acid or antioxidants to help the dryness. So hydrofacial is going to be great. Microderm, not so great when you have that physical irritation, but dermaplaning, hydrofacials, and any light chemical peels are really going to help with that surface texture, and it's going to help your skin really kind of soak up those nutrients.
Wow, that is so great. There are so many ways that on the overall approach,
Yeah.
you can help someone who has that winter redness skin.
Absolutely.
It's all here. You just have to come and do it. I think from my perspective,
Yeah, I'd love to know what your perspective is
well,
too.
I'd like to get a little more focused to help someone's skin. While you can take the overall approach and really help them, there are things for people who have rosacea or red skin that we can do that are unique to the dermatologist.
Yeah.
There are prescription creams that actually reduce the flushing of rosacea for about 8 to 10 hours. So you put them on, you rub them in, and your face doesn't flush or turn red for most of the day.
That's a big difference for patients.
Yeah, that's specific. And then if you have even more specific blood vessels that are dilated or broken across the nose, face, I've had many of these treated myself with Dr. Walia, our laser expert. We have a laser to treat those. The pulse dye laser that we have in the office, someone can come at any time and get specific blood vessels on their face treated and gone like that.
And I've actually had one of those before as you, and they're not that painful.
No.
It's quick and it's easy and it doesn't hurt that bad.
No. We want you looking your best and getting ready for the winter and not having red skin. So come see us. Thanks.